Hello to the Open Door community. I'm Dr. Wu, Chief Medical Officer of Open Door Family Medical Center. Since the beginning of the COVID pandemic, we have been impacted in so many ways. But one thing has remained consistent, and that is Open Door's commitment to our communities. To date, we have tested more than 24,000 patients for COVID-19, and we have cared for more than 4,500 patients who have been infected. Around the country, more than 500,000 people have already died. And around the world, that number is 2 million people. Because this is a new virus when it first came out at the end of 2019, we have not had the natural immunity or the defenses to fight off this virus, and for that reason, so many have suffered in such a short period of time. We know that more infections will happen. We know that lives will be lost here, around the country, and all over the world, until the situation is under control. But the good news is, with the recent development and release of vaccinations, we are better able to reduce COVID-19 infections and deaths now more than ever before. Many community members have shared their questions with us, so today I'd like to answer some of the most frequently asked questions we have received. How safe are COVID-19 vaccinations? I could tell you absolutely, unequivocally, the vaccines are very safe. Before these vaccines were approved for use in the public, they were tested on tens of thousands of volunteers in this nation, and they were found to be safe and effective. And since their approval for use in this country, there have been more than 50 million vaccinations given in just the last few months, and the data collected confirms that they are not only safe, they are extremely safe. What are the potential short and long-term side effects of these vaccinations? Long-term side effects data is unknown at this time since these are very new shots. However, from a scientific perspective or point of view, there aren't significant long-term side effects expected, just as there are very few concerns about other commonly used vaccines over the long term. On the short-term side, there may be possible side effects, including, most commonly, aching in the arm. Fever, chills, fatigue, and headaches are all possible, but these side effects resolve within 1 to 2 days, do not indicate infection, and do not have any lasting complications. Are some people more susceptible to side effects than others? In general, patients with a stronger immune system will experience more side effects. That is why elderly folks who have naturally lower immune reactions compared to younger individuals may experience fewer side effects than the younger adult population. This is also why more people will experience side effects after the second shot of a 2-shot series, because the second shot boosts the immune system further after it has already been activated by the first shot. Do the vaccines have benefits that outweigh their risks? Yes, there is no doubt that all the benefits heavily outweigh the risks. The easiest way to think about it is this. More than 28 million Americans have been infected with over 500,000 deaths. And yet more than 50 million doses of vaccine have already been given with 0 deaths linked to the vaccination. And is one vaccine safer than the other? All the vaccines that are available from Pfizer, Moderna, and Johnson & Johnson's product are considered very safe. Choosing between them based on safety is simply not necessary. Whichever vaccine is available in the community is the one that I would be happy to accept for myself and for my family members. How effective are the vaccines? All the approved vaccines are highly effective. Pfizer and Moderna, both which require 2 shots, give 94 to 95% protection against COVID. Johnson & Johnson's single-shot vaccination is overall 72% effective against COVID, preventing COVID, but very importantly is 86% effective against severe cases of the infection. Let's compare these levels of protection against what we would expect from a typical flu shot, which is about 50% effective. So when we're talking about 94 to 95% effective rates, clearly these vaccines against COVID are excellent. Are the vaccines effective against new COVID-19 strains? Right now, the new vaccines are being studied against the new COVID-19 strains, and it is expected that they will be less effective than against the original strain that they were produced to fight against. A virus may mutate and create new strains, but that does not mean it is 100% resistant against vaccines. Our current vaccines will definitely be very helpful in protecting against COVID, regardless of the strain, and will reduce the risk of severe disease, even if they do not completely prevent us from getting the infection. Can pregnant women and children get vaccinated? Pfizer and Moderna's vaccinations can be given to pregnant women. They already have an indication for that. Johnson & Johnson's product has not yet been given that approval, but we expect that they will receive that approval in time. And it is expected that children will be able to get vaccinated, but not enough children were tested in the pre-approval process. Right now, Pfizer's vaccine has been given approval for individuals 16 years and older, while the Moderna and Johnson & Johnson's vaccines are indicated for those 18 years and older. Where can you expect to get vaccinated, and how do you bring your family to get vaccinated? Because supply of vaccines is very low in comparison to how many people want them, the government has purposefully used a phased distribution plan to ensure that the most vulnerable individuals, the elderly, healthcare workers, and others who come in contact with many people, such as school workers and police and firefighters, that they are given the opportunity to be vaccinated first. Additionally, those who work in grocery stores, restaurants, public transportation are also high on the priority list. After the above groups, anyone who is over 16 years of age and has a pre-existing condition, such as a lung condition, asthma being the most common one, or heart disease, such as high blood pressure, or diabetes, or any condition that causes lowered immune systems, or if one is overweight or pregnant. All these are priority groups now. When will Open Door be providing vaccinations? Open Door has been vaccinating for the last several weeks. We have very limited vaccine supply. Once we receive a supply of vaccines, we then begin scheduling appointments for patients. But as soon as we run out, we must wait until we receive more vaccinations from the federal or state governments. As vaccine production increases and when we receive vaccine shipments more regularly, we will be able to vaccinate more broadly as well. Which vaccine will Open Door provide? So far, we have been giving Moderna vaccines in our facilities. We also are giving Pfizer vaccines in special projects in conjunction with the Department of Health in various community centers outside of our offices. Where else, aside from Open Door, can patients get vaccinated? The state has created many vaccination centers, including at some area hospitals such as Northern Westchester Hospital and the Westchester County Center. Will I be able to get vaccinated if I'm uninsured or underinsured? Regardless of insurance status, all patients need to know that COVID vaccinations are entirely free. Health insurances will cover the cost of the vaccine, but insured patients will also be able to get the vaccine absolutely free. How do I determine eligibility for the vaccine? There is an eligibility criteria tool on the New York State Department of Health website. Anyone who is eligible for the vaccine based on New York State eligibility criteria can get the shot. We have already vaccinated most of Open Door's patients over age 65, and now anyone who has a pre-existing condition that is accepted on the state's eligibility criteria can be given an appointment for a vaccine, of course depending on vaccine supply. Do I still need to social distance and wear a mask if I am vaccinated? Even after vaccination, it is absolutely recommended that people continue wearing masks and maintaining social distancing. These vaccines are not perfect, they are very good, but they do not necessarily prevent you from spreading the infection to other people, even if you have been vaccinated. What should I do if a friend or family member is hesitant or unwilling to get vaccinated? Share the facts. The vaccines are extremely safe. On the other hand, we know COVID is very dangerous. It has killed 500,000 Americans already. It is the greatest danger our country has faced, and it will kill more Americans than any challenge we have ever faced. The more people that get vaccinated, the more control we will have over COVID-19. How long does it normally take for patients to get their COVID-19 test results? The average turnaround time for a lab result for COVID is 1 day, but it's not uncommon to sometimes need 2 or 3 days before we get the result. What advice would you give to patients who need to travel during the pandemic? It is very important to maintain precautions if you choose to travel. You can wear 2 face masks, wash hands, maintain social distancing whenever possible. Whether you and your family choose to travel is your individual decision, but the main thing is to know that there are risks to traveling. So, if you so choose to travel, please take all the necessary precautions to minimize your risks. How has the virus been spreading in Lower Hudson Valley, specifically in Westchester County? Clearly, the news has been telling us that right now the COVID situation is much better than before. Across Westchester County, the positivity rate is 3 to 4%. In Open Door, we still have a positivity rate of 17%, and that is because our patients typically have higher risks because of the work that they do and because of their living situations. How has the pandemic evolved at the state and national level in terms of infections and mortality? Many people are aware that due to holiday gatherings, the pandemic spiked significantly at the end of November and through January. The good news is that the rate of infections has declined a lot since mid-January. Also, because we now know much more about treating the infection, fatality rates have decreased very much compared to at the beginning of the pandemic last spring. What have we learned about the new COVID-19 strains in the United Kingdom, Brazil, and South Africa? We know that the new strains are a lot more contagious. That means they spread a lot more easily. However, that does not mean they are more deadly. They are not. They are not more deadly than the original strain. We know that our current vaccinations may not be as highly effective against the new strains, but they will give a lot of protection against them, especially against severe disease, because the vaccine-enhanced immune systems will be ready to fight the infection, even if it's a new strain, if it occurs. What are the best ways to protect myself and my family from COVID-19? In addition to wearing masks and practicing regular hand hygiene and hand washing and social distancing, the most important thing is to get vaccinated. The vaccine may not entirely reduce your ability to pass the virus to others, but it is very likely to reduce your chance of having symptoms such as coughing and congestion, and that alone means that a vaccinated individual, if they're carrying the virus, will be less likely to spread it to others. Which masks are most effective? The most effective masks are the medical grade masks, such as those surgical masks you see many people wearing now. N95 masks are the best and do not require double masking, but they are much more expensive and should be saved for healthcare workers. You may recall, many healthcare workers got sick and thousands died last spring at the outbreak of the pandemic when there was a shortage of personal protective equipment, including N95 masks. We need these masks to protect our clinicians and care teams when they are caring for the sick. What role could holistic or preventive care play in combating the spread and burden of COVID-19? Anything that increases your immune system helps against COVID. That means eating healthy foods, more vegetables, fruits, for example, and less of the inflammatory foods like fried, greasy, processed, and sugary foods. Eating healthy foods will help protect you against COVID. It boosts your immune system. Getting enough sleep is very important too. Our immune systems drop when we are chronically tired. And it is very important to know that obesity has proven itself to be one of the biggest risks for COVID, perhaps even more than smoking cigarettes. And that is because obesity usually means there's already a lot of inflammation in the body, which is one reason why obesity strongly leads to diabetes and high blood pressure and several cancers. And because obesity automatically reduces an individual's ability to breathe deeply, that's a problem too, because COVID kills primarily by attacking the lungs and causing breathing problems through pneumonia. And in the impaired lung volumes that people who struggle with obesity have means that they have a harder time fighting off COVID when it gets to their lungs. If I have any other questions, how can I get in touch with Open Door? If you have other questions, Open Door has many ways for you to reach out to us. You can call 914-632-2737. You can email us at hello@opendoor.org. odfmc.org. You can periodically check our COVID-19 page on our website. And we also have COVID-19 texting campaigns to our community of patients who are eligible to be vaccinated. We truly understand that many people are eager to receive the COVID-19 vaccine, so please know that we are working closely with the federal government and New York State's Department of Health to make sure that our processes are in place so that we can provide as many vaccinations as possible, given the supply of vaccines. It is as true today as it was at the start of the pandemic. We are in this together. We appreciate your understanding and look forward to continuing to serve and vaccinate our communities. Thank you.